Hey, future registered nurses, welcome back to another Sarah Michelle NCLEX review YouTube video. My name is Chelsea, and I am a team member here with Sarah Michelle NCLEX Review. For today's video, let's review wound care and factors that can complicate wound healing. First, do you remember the difference between an acute and chronic wound? An acute wound typically heals within 4 weeks. A wound is considered chronic if the healing process takes much longer, usually more than 4 weeks, and can last months to even years. When we think of acute wounds, what can you think of? We may picture those small lacerations or even mild burns. Can you think of any wounds that may be considered chronic? If you guessed pressure ulcers, you would absolutely be correct. Other chronic wounds could be related to malignancy or even those foot ulcers that we see in clients with diabetes. Let's also review the layers of the skin if this is something that you have not thought about in a while. Remember, the outermost layer is called the epidermis, the middle layer is the dermis, and that bottom layer is the subcutaneous layer, which is where all of the fat lies. There are a few basics when it comes to wound care. There is a balance between getting rid of excess fluid from the wound while maintaining that moist environment that is ideal for wound healing. Keeping the wound moist allows for quicker wound healing, less scarring, less pain, and decreased risk for infection. You may have heard of tissue that is necrotic. What does this mean? Necrosis is just a fancy way of saying dead tissue. Necrotic tissue should also be debrided to speed up wound healing. Debridement simply means getting rid of the tissue that is dead to make room for new and healthy tissue. This process also reduces the risk of infection. Often, clients will also have swelling in the wound, and in these cases, depending on location, we can use compression bandages to assist with the reduction of swelling. We have to assess factors that may give us clues if the wound is not healing. Any ideas what signs and symptoms we may see? The client may report fever, chills, increased pain, drainage, or pus from the wound, which can be green, yellow, or brown. You may also notice new odor or more redness. So, given what we now know about the basis of wound healing, let's discuss some dressing techniques and types to assist with healing. Can you think of any? You may have heard of a foam dressing. These types of dressings are great for a wound with a lot of drainage and will do a great job to absorb all of the drainage. Think of foam dressings for surgical wounds, infected wounds, pressure ulcers, even leg ulcers. Remember when we mentioned a little moisture is good for wounds? That is when those hydrocolloid dressings come into play. A hydrocolloid dressing traps moisture and exudates, which are the fluids that leak around the vessels. Exudates are essentially what you see ooze out of a wound, also known as wound secretions or drainage. Exudates play a huge role in wound healing because it promotes cell growth and destroys dead tissue. So, what type of wounds could you use a hydrocolloid dressing with? You will commonly see a hydrocolloid dressing with donor sites, venous ulcer, burn sites, or even small abrasions. With each dressing change, bacteria is cleansed and washed away, again leading to wound healing by getting rid of debris. There are also films such as Tegaderm. I'm sure you have all seen this in clinical. A Tegaderm essentially allows oxygen to pass through, but prevents bacteria and other proteins from entering. Sometimes you may even see these covering intravenous lines as well. So there are just a few of the many types of dressings used for wound care, but we discussed a few that you may see as a new registered nurse. Before we move on, let's walk through a quick bonus question. What type of dressing might we use for a heavily draining wound located to the abdomen? You guessed it. We can use abdominal wound dressings, also referred to as an ABD pad. They come in all different sizes and work great for large trauma sites to provide cushion and even heavily exudating wounds. Wounds are so complex. There are so many factors that affect wound healing. Can you think of anything that would prevent or slow down healing? When a client is incontinent of bowel or bladder, it would definitely affect healing. This is due to moisture on the skin, which compromises the skin integrity. Other factors include malnutrition or lack of protein intake, hypoxia, smoking, advanced age, or our immunocompromised patients. A huge factor is if a client is immobile or bedbound. Remember why those every 2-hour turns are so crucial. Padding those bony prominences is also extremely important. Poor circulation is a big one too. If circulation is decreased, then oxygen will not make its way to the wound, and therefore healing will be slow. This is why our clients with diabetes require additional education. So now we know what can affect wound healing. Let's talk about client education. Can you think of any specific education? Clients could make sure to eat a diet rich in protein. Protein helps repair tissue, aid in tissue growth, and repair the wound during the healing process. Some good examples of protein foods first include meats, eggs, and lentils. Clients should ensure to keep their skin clean and dry, again, to reduce that moisture that can break down the skin barrier. For our clients with diabetes, tight glycemic control should be a priority, and frequent monitoring of the skin is essential. Smoking cessation should continue to be assessed due to that connection with decreased circulation and therefore decreased oxygen to the tissues. How would a client know if their wound is not healing well? The same signs we mentioned earlier. Do you remember some of those signs and symptoms? Fever, increased redness, drainage from the wound, and increased pain. Okay, let's talk about a great way to remember what can lead to decubitus ulcers. These are also known as pressure ulcers, or you may have heard these called bed sores. Let's review the stages of pressure ulcers. A stage 1 pressure ulcer is when the skin is not yet broken, but it is non-blanchable. Non-blanchable is just a way of saying there is discoloration of the skin that does not turn white when pressed upon. Stage 2 is when the skin is broken to the dermis or epidermis. Stage 3 occurs when the wound extends to that subcutaneous fat layer. And lastly, stage 4 is the most severe. These pressure ulcers will extend to the bone, the muscle, or the tendon. So let's use a fun mnemonic here. Skin, S-K-I-N. The S stands for the surface to be smooth. The K stands for keep it moving. The I stands for incontinence management. And lastly, the N stands for nutrition. Understanding warning signs to assess for is crucial because you may have to know what type of bed sore to report to the provider. In some cases, there may be a registered nurse that specializes in wound care treatment. All right, let's complete a practice question here. So this is a select all that apply question. Which of the following sites are likely areas where pressure ulcers may develop? 1, the abdomen. 2, along the spine. 3, the axilla. 4, bilateral heels. 5, the coccyx. 6, the lateral malleolus, and 7, the posterior portion of the head. Feel free to pause here to have enough time to answer this question. It is common to see skin breakdown to the heels, greater trochanter, back of the head, ears, elbows, and the malleoli, which are the parts of the ankle. Let's walk through the correct answers together. Okay, you can see here that many of these sites have something in common. Do you know what that is? Many of these sites are bony prominences or pressure points on the body. Along the spine, both heels, the coccyx, lateral malleolus, and the back of the head are all parts of the body that are at higher risk for pressure injuries. The abdomen and the axilla are not areas that are generally susceptible for injury. Now that we know areas of the body that are at increased risk for breakdown, we can then educate our clients and caregivers about frequent repositioning and use of wedges or pillows to alleviate that pressure. And those are the basics of wound care. Some facilities, depending on where you work, may have a wound nurse that specializes in the care for these clients. However, it is just as important for any registered nurse to be able to identify wounds, help prevent, and educate clients about the basics of wound care. Thank you for joining me today. Make sure to hit subscribe and don't miss out on our next video. Happy studying!